Good afternoon. I'm Becky Bartosik, President and CEO of the Fox Cities Chamber of Commerce. Welcome to the third community briefing in our Healthy Fox Cities series, presented by Ascension, Wisconsin. Thank you, Ascension, for your sponsorship. Today's briefing is entitled Reaching Out, and that's exactly what we want to take some time to do today. As your Chamber of Commerce, community is our first priority. And to see so many individuals, families, and businesses hurting in the wake of the COVID-19 pandemic, we are compelled to help. Today's panelists have been invited to share their knowledge with you and point you toward resources that exist in the Fox Cities and across our state that are working to reach out and provide assistance during these challenging months. Today's panelists are Lisa Smith, Manager of the United Way Fox Cities 211 Outreach Program, Missy Hughes, Secretary and CEO of the Wisconsin Economic Development Corporation, and Scott Radtke, Chief Clinical Officer with Catalpa Health. Each of our panelists will give some introductory remarks outlining resources in our community, and then around 12:30, we will open it up for discussion and questions. If you'd like to ask our panelists a question, please use the Zoom Q&A feature to submit it. If you are a member of the media, please also state your affiliation with your question. Please note that the Q&A feature is different from the chat feature. To ensure your question is seen by our moderator, please use the Q&A feature whenever you have a question for our panel. I also want to let you know that this presentation is being recorded and will be available to view as a rebroadcast on the Fox Cities Chamber of Commerce website. Lisa Smith, we're going to hear from you first. As the manager of the 211 program, you're talking to people in the Fox Cities every day. Tell us more about this great United Way program.
Thank you so much. Sure. So 211 is very simply a dialing code. It was created nationally back in the late 90s, and then especially after 9/11, it was created and promoted and really mandated for states to build an infrastructure where there would be a secondary source of live answer 24/7, again, a dialing code for those types of calls that didn't maybe rise to the level of a 911 call. We are part of United Way in that they support the 211 system, and we're very integral in getting this up and going. But we are a dialing code, and again, every state does have a 211 system. So here in Wisconsin, we are eight call centers. So the one located in Menasha is the call center, of course, locally. And we are located within the United Way Fox Cities, but we do serve a 10-county radius and are supported by multiple United Ways, as we are supported by statewide funding at this point. So quickly, I just want to tell you, we were activated very early on March 1st as a statewide system, one of 17 states to have their State Department of Health Services activate 211, which simply means we're doing what we were created to do, to help people 24/7 with live answer, a real person answering the phone, providing rumor control, information about the disaster, or in this case, pandemic, trying to connect them with resources, and just basically being there as a supportive listener. And in fact, that's what we ended up doing initially. A lot of our callers had questions where there were simply no answers. But I can tell you that a lot of people were saying, we're just so happy to speak to a real person. If you kind of remember back in March, there were many agencies that weren't able to live answer until they could figure out basically what to do next and how to deliver services. So since the pandemic began, we really saw a lot of calls initially, again, about the COVID overall symptoms, folks who were concerned about the stay-at-home orders, maybe wanted to call and report violations of the stay-at-home orders, had a lot of questions about the actual COVID pandemic. And of course, 211, we are not case managers, we are not healthcare workers, we are certainly not, mental health specialists, but we have training in all those areas, and in many cases, we were able to provide at least some assistance. Very early on, we, as a statewide system, had a representative in the statewide emergency operations center daily. So we were feeding them information about the types of calls we were getting, and then we were getting information, vetted information back from that state SEOC, helping us answer those questions. As time went on, however, those calls started to shift over to the things that you would normally think of us at 211 as doing. Rent assistance, utility assistance, help with maybe even internet or unemployment. That was a huge, huge call for us early on. To give you a little perspective on numbers of calls, a typical year for us here in the Fox Cities is about 12,000 calls. We are over 20,000 calls at this point already. Statewide, we're approaching 70,000 calls since March 1st. But again, that's because we've been activated, and many of the public health departments in the state of Wisconsin were able to, kind of get calls to us when they weren't able to answer live and provide information. So as time has gone on, we've seen some definite trends. Again, rent assistance, I will say, is the #1 issue we're facing in this community, in Outagamie, Calumet, and Winnebago counties. People are at risk of being evicted. They may have used all of the local resources and some of the statewide resources provided during the pandemic. So that's a huge issue for us. Another issue can be folks who are homeless currently and maybe can't get into the shelters because they either have tested positive or may have symptoms of COVID. And as the cold weather approaches, we've had concerns about folks being out in the streets, either COVID positive or with symptoms, and with low temperatures. Our typical places to send folks like that would be the public libraries, and unfortunately they're closed as well. So just something to keep in mind. That's a concern for us. To get in touch with us, it's very easy. The beauty and the value of 211 is that you're going to get a human being on the phone 24/7. So you simply dial the number 211, and you will be routed to myself or one of our staff. After hours and on weekends, we do have a statewide after hours provider. It's another 211 call center. So there should never be a time when you can't speak to us. We do provide text options and chat between 8 and 5 daily, but that is not available at nights and weekends. We also have some online options for folks to search online. But what I always say is the value of this program is not the technology. It's the ability to dial a 3-digit and talk to a human being and get some answers, possibly just some supportive listening. In many cases for this pandemic, we've provided a lot of transfers directly to agencies or sources of assistance. We've provided a ton of advocacy, and again, just really trying to find answers for people when they call us. There's really no wrong reason to call 211. We're the umbrella. You call 211, we're going to try to figure out who to best get you to, the best source of assistance as quickly as possible. So we don't provide the assistance directly in most cases, but in some cases we do definitely want to make sure that the person is talking to either a professional in mental health, substance use, maybe it's an agency providing financial assistance. We want to make sure they're talking before we leave that call, and we do that more and more, especially during this time.
All right. Thank you so much, Lisa, and thank you for connecting our community with the resources they need during this difficult time. You and everyone on your team are doing such a fantastic job, and we can't thank you enough. So we've talked a lot about the resources with Lisa, but what if you're a business owner? You have had unique challenges in this pandemic, and the resources can be hard to find or even understand. Today, we have just the person to talk us through some of these confusing and challenging business topics. Missy Hughes, thank you so much for being here today.
Yes, unmute. Thank you, Becky, and thank you for having me here today. I thought I would just take a moment and describe a little bit about what WEDC has been focused on as the pandemic has hit Wisconsin. So, if we all remember back in March, as Lisa reminded us, this kind of came across in a wave. And what we really saw was that wave hitting our businesses that were places of gathering. So if you remember, we weren't supposed to have gatherings of more than 50 people, and then more than 10 people, and then we went into our safer at home process. And so as WEDC watched that happen, we really felt it was important to do everything we could to get resources to businesses as quickly as we could. And we worked directly with the Small Business Administration to have Wisconsin named as a disaster. There was an economic disaster declaration that was made, ended up being made for all 50 states. And we knew that there would be a lag between federal resources coming into the state and being able to, act quickly. And so we were able to stand up 2 programs right away. One called the Small Business 2020 program, which was for businesses with 20 or less employees. And then the Ethnic Minority Emergency Grant program, which was designed for businesses that were really potentially falling through the cracks. Those unbanked or micro businesses, they're sometimes called underbanked, really businesses that are running on cash and so might not be able to access PPP and things like that. We then, kept going forward and have been involved in the deployment now today, 6 or 7 months later, of over $220 million in CARES Act funding. So we built systems and built the means to get those dollars out. And we learned a lot from building those systems, learned a lot about what the businesses are going through. Our first phase of working with 24,000 businesses on the We're All In grant program, which was $2,500 per business, just gave our team a real chance to understand what the small businesses of Wisconsin were facing. The second phase of We're All In, which is just happening right now, we stepped in and worked with Department of Revenue to really get those funds out as quickly as we could. That's a $5,000 grant. And then finally, we are now trying to reach out and help businesses like restaurants and bowling alleys, those real places of gathering that are a little bit larger, with a larger grant of $20,000 each in order to hopefully help them withstand the winter months. So, hopefully businesses in the Fox Valley were able to access some of those resources. I'm sure they were. But the other thing that we did that I think is equally as important and somewhat of the focus for today is making sure that businesses had good information. If you recall, back in March and April and May, there was just a torrent of information and conversations about what should be happening, what should businesses be doing, should they be closing, should they be staying open, are they essential, are they non-essential? And WEDC took on the role of really trying to be a curator of the right information. We were critical in helping businesses determine whether they were essential or non-essential. I hope that we never ever have to have that conversation again, because that was a dumb conversation. Every business is essential, but it was the way that evolved and where we found ourselves, I think, as a nation in trying to determine how to address staying at home and being safe. We launched what's called the Focus Forward website, and you can find that at wedc.org. And the idea there was really to get information in an accessible way to businesses. I did a number of videos, just quick videos, because we found people were having a hard time reading things and just, absorbing all the information. So we tried podcasts and we've done videos just to continue to make information available to businesses. We also launched the WEDC Business Guidelines, which helped businesses determine whether or not what to do. How do I stay open? How do I think about my business when I do reopen? If you remember that time between May and June, as we were moving back towards opening, I, coming from the business sector, the private sector, really felt that it was important to be supportive to businesses in that moment when they're walking back into their cafe or their shop and saying, okay, how do I run my business in the midst of a global pandemic? And how do I do this? And so the intention behind the guidelines were to be very practical and very thoughtful about just getting that tactical details of how you protect your employees and your consumers and your community. Today, we continue to be focused on those guidelines. We are working on mental health guidelines to help businesses if either an employer is facing mental health challenges just from the incredible stress that they're going through, or they're seeing that in their employees. I know from my team, we've tried very hard to stay in touch with folks and understand what they're going through, but in a remote world, it's really hard. And, with kids at home, with not being able to see your elderly parents at their nursing homes, it's just the amount of stress we're all going through is really incredible. And so we want to make sure that folks have access to and know where to find resources. One thing that's just come up starting this week or the last few days is understanding that businesses are going to need information about the vaccine, and they're going to need information about, do I require vaccines? What do I do if I have somebody who doesn't want to get vaccines? How do I work my way through this? And so we are working directly with the Department of Health to think about what kind of information can we provide to businesses, and also just to share information about how the vaccine is going to be distributed and what the plan is for that, so that businesses can plan. So we've really tried to provide both resources and information throughout this whole pandemic, and we will continue to do that. I really want to emphasize the ask today about reaching out is what I've learned even before the pandemic, but now I've really seen it in action, is the incredible support network that we have in Wisconsin in every town, whether it's a chamber or whether it's an economic development organization or banks or credit unions. There is support there. And there are people who are really eager to help businesses. They're really eager to provide just, a shoulder to cry on, or, even better yet, solutions. And so for folks who are hesitant to reach out, or who think that their problems don't rise to the level of needing to reach out, you should reach out, because we've built and invested in an incredible network of support in Wisconsin just to be ready for this moment. And so it would be a shame to let that network go to waste. So do your part by asking for help and giving those folks the opportunity to help you, because I really think that's one of the beauties of Wisconsin, is our willingness to reach out and help each other. And so that means asking for help, and then the support will be there for you. So I look forward to questions about any of that. Thank you, Becky.
Missy, I really want to thank you sincerely. You and your team have just been tremendous throughout this entire pandemic. I do know from how many times I've seen you at different events, I doubt you got much sleep for many months. So thank you again for all of your efforts.
Thanks, Becky.
I do also want to remind everyone that at the Chamber's Fox Cities Regional Partnership, we have staff members available to assist you with questions you might have about applying for the small business loan programs in Outagamie and Winnebago counties. These are 3 to 5 year loans with no interest or principal for 6 months. We'll put the contact information in the chat feature for you as well, so that you can reach out. Now we're switching gears to another critical topic, mental health. Our third panelist today is on the front lines when it comes to addressing mental health challenges in our community. Scott Radtke. The pandemic has pushed the topic of mental health increasingly to the foreground, hasn't it?
It sure is, or has, and I appreciate the opportunity to talk about our work in the community. For those of you that aren't familiar with Catalpa, Catalpa is an 8-year-old organization working with kids with mental health issues, serving a pediatric population. We have a really fantastic story about how we're formed, which really speaks to, I believe, how our larger community responds to times of crisis, which includes right now in the COVID-19 pandemic. Catalpa was formed really in a true spirit of collaboration and working together with our healthcare systems of Ascension, Wisconsin, Theta Care, and Children's Hospital of Wisconsin, all coming together and deciding that independently, the issue of pediatric mental health is much greater and much more complex than what any of us can do independently, and much greater than what we could do working competitively. So in a unique action, all 3 of those health systems, with the support of the greater community, decided that they were going to pool all of their resources into one agency, which they continue to support today. So we continue to work in the Fox Cities community, but also Oshkosh, Wapaka. We are serving kids in over 50 schools throughout the community as well. More than 9,000 families per year come our way. What the pandemic has done in our work is we've shifted our services. You know, prior to March, all that was done face-to-face, but we are now providing services through telehealth. And for those of you that aren't familiar with what telehealth services are, it's a patient, family connecting with a provider who can help when they are in different locations. So what's often common in the work that we're doing now is families are at home, our providers are either in the clinic or at home, and they're able to connect effortlessly to provide the same level of quality of care than we were doing when we were in person. So that work continues and needs to continue because, as was talked about, there is a lot of stress in dealing with the pandemic. I think all of you feel it to a certain degree. You know, and how we measure that at this time, there are a lot of different ways. Certainly, you've seen the national data on mental health and how important it is to talk about those things. You've heard about increased issues related to suicide attempts and deaths by active suicide. You know, certainly in our own agency, we can measure that on the requests for services that we get each and every day and how we can best manage those requests coming in with the staff that we have available. But all of you in your with your organizations that you're with, you can see that in work performance, attendance, and just the overall stress that adults in the community, not only kids, but adults in the communities carry each and every day. So I do want to make a couple comments about just kids in mental health, and do want to start in a, you know, with a positive frame about them with two comments. One, it's important to remember that kids overall are very resilient. I often think that my kids are more resilient than I am as an adult, and that's really important. And also that mental health issues are absolutely treatable. They've been treatable before the pandemic, and they're treatable now. So one of the things that I think it's really important that I say today, and all of you here, is that early identification, getting people connected to services and providers that can help them are really important. These are trying times, and the trying times have certainly gone on longer than any of us anticipated. I think for all of us, if we can see the end of a difficult period, it's easier to cope. And I would say for all of this, when we were in March, none of us anticipated that we still would be at this place right now in December. With hope in the future, but still we are dealing with a lot of stress day to day, and especially as we move toward winter. So when we're looking at, like, how do we get people in our community connected to support? What do we do? You know, certainly great resources that you've heard about already. I do want to stress again the importance of 211 as a resource in the community. Certainly if you're concerned about your child, talk to your healthcare provider. Talk to someone that you trust. I think that's the most important thing. It's not necessarily who you talk to, but that you talk to someone about what you're seeing, what your worries are, so that resource can help get you connected and determine where you go next. NAMI Fox Valley is a tremendous resource that a number of our kids in our community use and their parents use. So that's important as well. But I think more than that, I think there's a charge for all of us to talk about how we can reduce stigma in this community. And I think one of the challenges is that we all can automatically think about mental health issues as something wrong with me. There's some sort of weakness that I have. But I think what's important to understand is, like, the struggles that each of us are dealing with independently. If we would have an opportunity to talk about them, I think we find that we're not struggling alone. The worries, the stress, you know, we hear about this from kids. You know, they're worried about employment of their parents. They're worrying about school. They're worrying about losses in their life. It's important for all of us, both kids and adults, to find resources and to talk about what's going on. Because although what's going on in our world is definitely abnormal, our reactions to those situations are very normal. So, but the important part is if we can find those outlets and find those resources that can help as early as we can when things start becoming a problem, that's the best recipe to recovery and developing resiliency. So I look forward to any questions that you might have.
God, thank you so much for the important work that you are doing. I think we've all been surprised with everything that we've seen this year. And we just truly want you to know, we know that the work you're doing is very difficult and it's absolutely essential for our community. So from the bottom of our hearts, thank you for everything you're doing. At this time, we're going to keep the discussion going with our question and answer session. Just a reminder, if you want to ask any or all of our panelists a question, please type it in the Q&A box and we'll be happy to pass it along. I believe there are already some questions that have been submitted. Let's take a look in the queue. Our first question is from Missy Hughes. Child care has become an issue that is increasingly intertwined with business, especially given the situation with schools and child care centers changing their operations, sometimes unpredictably. Are there any resources you can point to for our businesses whose employees are struggling with childcare?
Yeah, thank you, Becky. And childcare has become, as the questioner pointed out, such an incredible need across Wisconsin. And I think what we've really learned through the crisis is in order to be a productive member of the economy, you need to know that your children are in affordable, accessible, and safe childcare. You need to know, I mentioned before, taking care of your elderly parents. If they're in senior care, we need to have these kind of public good opportunities in order to help our economy really go forward. And it's one of the things that we're really focused on at WEDC, and we're working very closely with the Department of Children and Family Services because we see that real tie between the economy and childcare. We are working right now with DCF to understand what are the ways that we can integrate business into the childcare model. One of the real challenges I've learned about is the childcare business model is really tough. Being able to run a childcare and to be able to pay your teachers and your caregivers in a way that then keeps them there and is a healthy living wage for them is really important. And so right now DCF has received first a $10 million grant from the federal government, got that before the pandemic hit, to do a strategic plan, to do a strategic look at Wisconsin and understand where are the real gaps we have and how do we start to fill those gaps. And then they're applying for the next phase of that. That was really, if you can believe it, just a one-year grant. There's a next phase of that to be able to then implement some of that strategic plan. So that's just, at a 500,000 foot level, what's happening. I encourage folks to go to DCF to look for resources. There are resources available, but this is a real challenge that we have to fix. And so unfortunately, I don't necessarily have like this is how you can fix it on a one-on-one basis. But I think it's incumbent on leaders like us to continue to look for ways to work with businesses, to make businesses understand if you want to have, access to workforce, right, which is a huge issue, then we need to bring people off of the sidelines. And I think we have a fair number of people who are sitting on the sidelines because they're needing to stay home with their kids. And I will tell you, one of the biggest concerns I have is that women are bearing a lot of that burden. And if you remove women from the workplace, first of all, my mother's going to be really mad. from up there, she's gonna be really mad because she did a lot of work to get women into the workplace, and she was my model for being here today. But we're also, having a diverse workplace and having women in the workplace is critical for economic growth. It's been proven, the research is there. So we need to think about how to keep women in the workplace, and that means by having childcare. So this is a big nut that I think collectively we have to crack. But I encourage you to, for short-term understanding of what the resources available, go to DCS website.
Thank you so much, Missy. That was a tough question. So thank you. That was a really good answer. The next question is for the panel in general. How can members of our community reach out to provide help as volunteer opportunities and opportunities for personal interactions do continue to increase?
Becky, this is Lisa. I can speak on that. So we have a couple of great options in the Fox Cities. One would be Volunteer Fox Cities. They're coordinating with the Give Help, Get Help hub, which allows folks to actually put those volunteer opportunities online and on that website, and then folks can go to the website and view the opportunities available. But also Volunteer Fox Cities has, those capabilities to kind of coordinate that volunteer piece of the pandemic. But again, Give Help, Get Help. It's a website that has been created here by the United Way. It is not part of the 211 system, but we do utilize it to kind of keep up with the everyday things like masks. Those were things that were put on there. Oh, so-and-so is going to make masks, and you can reach them by calling this number. So that's a great resource to know about.
Perfect. Thank you, Lisa. The next question is for Scott. Well, as you mentioned, there is some light at the end of the tunnel. The winter promises to be long and dark. What are some strategies for getting through it from a mental health perspective?
Yeah, I think the first one that comes to mind for me is just understanding that it's still a marathon. It's not a sprint. I think at the beginning, what we found is when we were talking about, a period of maybe 2 weeks of being shut down or some period of time, I think there was some increased exhaustion just because those dates kept being pushed out longer and longer and longer. And there's a cumulative effect on all of us as we deal with that. So I think it's important to think of those small victories that you have and think of it like one day at a time. Break things down into chunks where you can find some success. I think some other things to do is to find opportunities to be connected to other people every single day, and that could be people that you know or maybe people that you don't know. I'd often, in my work as a therapist and working with people that had depression, I would often say to them, what can you do today to make it a good day for yourself or for someone else? And that continues right now. And I think sometimes if we just get caught up into the fact that COVID numbers may be rising, we're moving into winter, we're hearing more about darkness, that we can have an influence on our own lives and trying to find those small steps that we can take. If we look too far out, I think it could lead to more just exhaustion, but try to find how I can win the hour, how I can win the minute, how I can win the half day can make a difference.
Thank you so much, Scott. That's great advice. Missy, this next one's for you. How will the state help small businesses recover from the pandemic while at the same time supporting those businesses that are thriving and growing?
Well, I think, throughout we've really had a focus on the small businesses. Looking at the businesses, the types of businesses that were impacted, whether it was, the mom and pop retail shop on Main Street or our restaurants, that's where we've focused a lot of the CARES Act funding. I think the reality is some of our larger businesses have a little bit more resiliency than others. As we head forward, we need to be thinking about supporting those larger businesses also. And I think we have the opportunity to do that by the workforce that's now available. So in this weird dynamic of the pandemic, we've seen a lot of lower skilled workers be let go, laid off, furloughed. And so we want to find those workers and be able to help them get the skills they need to then, move into a more family sustaining job. And our manufacturing has a lot of opportunity for that. So I think we can find a holistic solution that helps the small businesses. We continue to find resources, look under the mattress at this point for resources and provide those to the small businesses, but also be looking especially at those employees who find themselves without work and get them into really meaningful wealth building work. I will say that I think critical to this is a additional federal program. And we're watching Washington, D.C. very, very carefully because I think that's going to be a real linchpin in our ability to help businesses get through the next few months and then really start to head towards recovery. I think as Scott said, it feels like the game posts or the goalposts keep getting moved on us, but now we see the vaccine and it's almost like, to use Scott's analogy of a marathon, miles, I run marathons. I'll tell you, mile 20 to 23 are the worst, right? So, and that's where we are. It's like you can see the finish line, we can see the vaccine, but it's going to be a tough road between now and then. And that federal stimulus, I think, is what's going to be critical to get us there.
Thank you. Thank you very much, Missy. The next question is for the panel in general. We've learned a lot today about help being available. What is your message to those who are simply afraid to admit they need help? How do you summon the courage to ask?
Becky, this is Lisa. I can start by just saying, simply dial us here at 211. We're confidential. We really don't ask a lot of questions of people. We don't know who you are, and so please, feel free to call us. Maybe we just want to chat about a few things. It's not even asking for help, but just finding out what's out there. And a lot of people do call us for that. They don't really say, well, I need help, but they're just curious about what resources are. And we're fine with that. We're going to provide those resources and make sure that those folks are connected.
Perfect. Scott, did you want to add anything?
Yeah, I'll add on to that. I think it's really important for leaders to be willing to show vulnerability to people that are in their lives and who they're working with. I think it's important to understand that we're all compromised right now. I mean, I talk to people out in the community how they're reporting that their employees are not able to process information in the same speed as they used to. And I'm explaining to them, like, that doesn't mean there's something wrong with them. It's everything they're going through, right? We have employees at our own organization that are trying to balance out being an employee and providing oversight of kids who are doing virtual school. That's a lot to add on. And then if you think about other stressors as well, it can build up. So important for leaders to be able to talk about that things are stressful. I actually did a YouTube video for my team and talked about how things feel heavier now than they did back in March. And the responses I got from employees were very heartfelt. Thank you. I thought I was the only one that felt this way. It gave them an opportunity to reach out and to ask for help. And I think in that they felt less alone, even though we are all working in different locations now.
I think it's a really good point, Scott. I know I was sitting on some different panels, in the spring. And even at that point, when I was asked what I was most concerned about, it was mental health, because you could just see it on people. And there hasn't been a break since then. So thank you for the work you're doing. We don't have any more questions in the queue, but we thought that we might take this opportunity. If each of you had a success story that you could share with the people that are watching today, if you happen to have one that comes to mind. Missy, could you start us off if you happen to have one?
I'm gonna come up with one, but I'm gonna tell one first.
Okay.
Just bear with me for a second, because it's something about what Scott was saying and about our kids. And in the crazy world that we live in, my son, gosh, it was probably 4 or 5 years ago during the Ebola outbreak, developed a really serious mental illness around his fear about that. And he, we were able to realize it. We were able to get him the help that he needed. Ultimately, he stood up in front of his whole high school class and told them what he had experienced and how he had recovered from it. And so the opportunity with teenagers to understand what they're going through, to help them, makes them into incredible human beings, because the mental health challenges are so stressful on kids, but if they have the right help, they're stronger for it. And so he's an incredible young man. We happen to be going through a pandemic now, and he's like, I told you all this was going to happen. So he's doing okay now, but I really wanted to emphasize for folks, getting your kids the help that they need. It's not like a broken leg, so it's really super hard, and as a parent, it's a real challenge to know what to do. But I think if there's anything today, that's a really important story. In the success stories that I know about, we just had a contest at WEDC that we called the We're All Innovating contest. We've been running a program called We're All In. We're all in this together. And our We're All Innovating contest invited folks to present the ideas that they've come up with to respond to COVID business challenges. And we received over 1,200 super innovative ideas. And this week we announced 212 winners. Our top 18 are fantastic. If you want to go to we'reallinnovating.com, you'll be able to find out the information. But I'll just give you an example. One of I think our top winner was responsible for developing a rapid test for COVID. So really, technically dealing with the challenges presented by COVID, and that happened here in Wisconsin. But another example is a group of restaurants that came together in Madison to support each other by making meals and then taking those meals out to the community. So there's a revenue stream for the restaurants, but also providing meals to the community. And that was also one of our winners. So we just had some fantastic stories, and I love the idea of Wisconsin innovation being brought to light and being shared. So that's a success story, I think.
Oh, fantastic. Thank you, Missy. Scott, Lisa?
Yeah, I'd happy to share two of them that come to mind for me. One relates to how we were pushed into delivering services, how we're talking to you now. And although that was an uncomfortable transition for a lot of us at the beginning, there's some real benefits that we are really truly understanding. I'll give you an example of them right now. So Catalpa Health has 7 psychiatric providers. So these are professionals that prescribe medication to kids. We have a state and national shortage of those providers. So what would typically happen before the pandemic is that these families would have to travel fairly large distances to pick, they'd often have to leave work. So if they're an hourly employee, they're losing income. They're picking up their kid from school. They're driving to our location, which Appleton or Oshkosh or Wapaka. They're having that visit happen and then they're driving home. So if you think about the cost of healthcare, we have to consider those costs on families as well. So right now, what we're able to do is we're able to have that visit with that kid who might be at home. Well, they don't have to travel. We can bring the parent into the session while they're on break at work, because they don't even have to be in the same room. We have the ability to do that. So for families that might have some resource challenges with finances, like this is an incredible win for them to be able to have visits happen. So that's one. The second success that I'll talk about is just how we as a mental health community
have come together to solve some challenging problems.
One of the examples that came up most recently is, what do we do when a child is having a mental health crisis where they are needing inpatient hospitalization and they test positive for COVID? If those units don't have the ability to serve, to isolate that kid, what do we need to do? So it's been wonderful to be a part of conversations with my colleagues at Ascension, Wisconsin, and other partnering agencies, the counties, to determine, like, okay, we need to do something, because if we don't have an immediate option to do what we usually would, we still have to provide care for these kids in some way. So that collaboration has really been an outgrowth during this pandemic. And it's one that I really am happy will continue once we're on the other side of this pandemic.
I couldn't agree with you more, Scott. I think that is the amazing thing that has really come out of this pandemic, is the partnerships, and in ways that we never thought they could be. I mean, I remember receiving a phone call from one of the local hospitals saying, we need lights. We need lights that will help, disinfect, and, talking to the schools and the wrestling teams about borrowing their lights for the hospitals. And I mean, just really, everybody's stepped up. Everybody has stepped up. And I think that these partnerships, we knock on wood, that they will continue to thrive. Lisa?
Sure. So kind of building on what Scott said, we also in this community created very quickly, the community came together through something called the Community Solutions Team, which was a group of agencies that got together, got on the phone, started talking about the issues. Early on, I was able to attend those calls and kind of let folks know what was coming into us. But as a result of some of that collaboration, and this community has come together so amazingly well. We do serve a number of counties, and I can say that we're just so proud of this Fox Cities community for what they've done. I got calls early on from some elderly folks, like out in Seymour, Shiofton, who were running out of groceries and paper products. And also some calls from folks here locally in Menasha and in Appleton. And, as a result of those community solutions calls, I was able to connect with Christ the Rock Church, who, basically then went and delivered these groceries and paper products to these folks. Now, that's not something that we would do every day, but at the initial phase of this disaster, it was so important. That's what they needed at the time. Our agencies like St. Joe's and some of our other basic needs agencies came together so quickly and came up with solutions to help people get food, keep shelter and clothing, that it's just been really heartwarming for us, for those little small grassroots stories.
No, that's fantastic. Thank you for sharing these stories with us. Well, it looks like we're going to wrap up a few minutes early and put 10 minutes back in everybody's day. And boy, I know we can all use that at this time. But I do want to remind you that this presentation has been recorded and will be available for a replay through the Chamber website. Some really great information was shared here today. I hope you will share what you have learned so we can get good information in the hands of as many people as possible. I also hope everyone will make plans to join us for our fourth and final Healthy Fox Cities panel discussion, which will be happening next Thursday, December 17th at noon. Our topic will be Your Healthy Workplace, with opportunities to ask questions about doing business, running an office, or looking toward reopening in 2021. There will no doubt be some more great discussion. So stay tuned to the Fox Cities Chamber website for information about registering for that one as well. As always, these events are free and open to the public, as well as recorded for later viewing. Thanks again to everyone who was part of today's event, especially our three panelists. And I wish you all a healthy afternoon until next time.